Hi, my name's Helen Collins and I'm the Head of Patient Experience and Involvement here at Ashford and St Peter's NHS Foundation Trust. We realise in work that sometimes things don't go as we want to and we make mistakes. What I'm passionate about is learning from those mistakes and actually not blaming, not pointing the finger, but actually looking at what happened, looking at the conditions in which we work, reflect on it, change it and make it better for the next time. Most importantly as well is saying sorry to the patient. We've done a training video today with Malcolm Brittain, and he had some experiences at our hospital that weren't ideal. And I want this film to be shared with you to show actually what an exemplar response is to when things don't go well.
My name is Malcolm Brittain. I'm a 78-year-old chartered engineer. I live in West Byfleet in Surrey. I was admitted to hospital in February 2019 for a total hip replacement. I came in the morning, had my pre-assessment blood taken, and 2 o'clock in the afternoon I was wheeled down to the operating theatre. Just before I got anaesthetised, the surgeon told me that the operation had to be cancelled because there was no blood available of my type, should the occasion arise. The problem was that somebody had inadvertently spelt my name wrong when they were filling in the blood request form. This was sent to the blood bank. They refused to release the blood. So the operation couldn't go ahead, which wasted my time and also wasted hospital resources with an empty operating theatre, etc., etc. So I had to go home. I was recalled again a fortnight later for the operation. That went well. And within 2 days, I was due for discharge. Again, I was discharged at 2 o'clock in the afternoon, but unfortunately I wasn't allowed home until 7 o'clock in the evening because my medication wasn't available, which meant I was waiting 5 hours for medication. This is quite frustrating because I felt that they knew what operation I had, they knew what medication I would need. I was expected to be available, but it wasn't. My second problem arose when I got home because checking on the discharge form when I was doing my medication, I found the form was for another patient. This of course had all their details, some of which were confidential, I shouldn't have seen. I immediately contacted the hospital and they apologised, and I was sent out a replacement form the following day. So I had to have stretch stockings to guard against deep vein thrombosis. These were measured and fitted in the hospital for me, with another pair sent home with me. When I tried the second pair on at home, they just were impossible to fit, and I noticed the size was much smaller than that provided in the hospital. Totally the wrong size, so therefore they were unable to be used, so I had to go and purchase some from the local pharmacy. So those are the 4 items I felt were of concern to me, which is why I then wrote a letter to the hospital expressing my concerns.
Okay. So not a great experience, and you know, as always, the first thing that we do for anybody who goes through things like you is to say sorry, and sorry for this to happen. So who did you write to after all of this?
So I wrote to a Mr. Thomas. That's the person I thought was the right one at the hospital, but in fact it turned out that the response I got was from a lady, Kathy Parsons, yes, Director of Clinical Services. I was expecting a negative response and defending all the points of the hospital that I'd made, but no, in fact, it was an extremely positive response I had from Helen. She had obviously spent, from Kathy, from Kathy. She'd obviously liaised with her senior staff, and they'd read my comments, they'd investigated my comments, and they gave a clear and lucid response to all of them. With the blood fiasco, they've now tightened up their procedures and given more training to the staff, so this should not happen again. With the delay in getting my medication, apparently more stringent prescribing has been put in place, so again this should minimise this problem. With the stockings, that is probably not now relevant because I understand that provision of stockings is being reviewed. They may not now be required. The discharge form, which was sent to me in error for the wrong patient, again, it was human error, and so procedures have been put in place to stop this happening again and to ensure patient confidentiality. So I was actually very impressed with the letter I got back from Kathy. She answered all my points, all my comments very positively.
Well, listen, I'd like to thank you for your sharing of experiences and, you know, the filming of this, really, because we're going to be talking to new staff month in and month out about complaint management, and your experiences are very important in that. It's
been good to come here, Heather, and thank you very much, Helen, and thank you very much for inviting me.
No problem.
Heather's my daughter-in-law, by the way.
No problem at all. Thank you.